Hey guys, I am in my studio. Yay! I do my videos in our garage because it is a quiet place. This is where I come to smoke. We do not smoke in the house, so I come out here to kind of unwind when I get done with work, although I didn't work today. But I did a video on anxiety and dental anxiety the other day. So today I kind of want to talk about sedation dentistry. This topic kind of came out of the blue, but I feel like it's important. I had other things I wanted to do videos on, but here it is. Oh, and also guys, I'm going to start incorporating some other things to my channel. I will keep the dental stuff separate. That way, those of you that are here for dental stuff, you won't have to hear me rambling about my other issues, because I do suffer from fibromyalgia, and I had an episode Tuesday, pretty bad, pretty severe. Haven't had one in a long time, so. But I will keep the two separate. If you're interested, you can still watch them, but it's not something you have to. So let's talk about sedation dentistry, because there's like 30% of the population that suffers from dental anxiety, which is a lot. A lot of people do not go to the dentist because of anxiety, so they're at the point now where everything is decayed, and they're going to have to get them pulled and get dentures. So I understand. I have anxiety in general. I've talked about that before. It's not dental anxiety. It's just general over things. So, but it affects every aspect of my life. So I do understand. But there are things you can do, guys. So if you are someone that is in pain, that is dealing with abscessed teeth, you can't chew, you know that you're at a point where you need dentures, but you're scared to death, there are options now. I don't have insurance at the moment, although if you do have insurance, it will not pay for sedation dentistry. I don't think. There may be some insurance companies that will pay for it for certain things, but most of the time it's not going to cover it. There are 3 different types of sedation. You've got mild, you've got moderate, and then you've got deep sedation, which is general anesthesia. That's what I had used for my implant surgery. And I only did that because I can't sit still. And I knew I was going to have to sit still and be still for a period of 2 to 3 hours while he put those implants in. So your mild sedation is going to be like a nitrous oxide. That is one of the less expensive forms, where I believe it's like $50 to $60. Now, of course, that's going to vary for different dentists. Moderate sedation is going to be your pill form. And that's what I use for my extractions. They gave me a prescription. I think they normally instruct you to take 1 the night before, and then the morning of your surgery, you're going to take 1 to 2, whatever it tells you. And then you take the rest of the medication with you to the appointment. That way, if you start to feel anxious, or you're waking up, or you're less groggy, they can give you another one to take. That probably will be about your cheapest route, because they're going to give you a prescription, and I believe almost all the medications that they use for dental anxiety do have a generic. So it's gotten to where you can get prescriptions pretty darn cheap. So that's probably going to be your cheapest form. I will tell you that I use that for extractions, and I don't remember anything. I don't remember much of anything. on the way home or anything. Now, of course, you do have to have somebody that can drive you. That's with any sedation. You're going to be groggy. You can't drive. So the deep sedation is going to be your general anesthesia. That's where they bring an anesthesiologist in, and this is going to be your most expensive. I paid $1,000. I was under, it didn't feel like long, but I believe I was under like 2 hours, maybe 2.5 hours. And then my office, they work with an anesthesiologist. So, of course, they have to pay the anesthesiologist. And then I'm sure there were some fees tacked on for my dentist in there too. But now the prices I got were saying like $180 for the first 30 minutes and like $115 for each additional 15 minutes after that. Let's go back to the moderate sedation. I don't think this is used very often, but I am going to go ahead and talk about it. I told you that moderate sedation is mainly where they give you medication to take. They can incorporate IV sedation in there. Now, it's not general anesthesia. What they will do is give you, you know what? I'm kind of unsure on this topic, so I'm not even going to talk about it. But you do have that option to where you don't, it's not taking pills, and it's not general anesthesia, but it's kind of in between. I don't know much about that, so I'm not even going to speak on it because I'll make myself look silly. But you have options, guys. You know, I'm one that understands that when you have anxiety, actually getting up the nerve to make the dentist appointment or to call the dentist can be unbearable. If you have someone that can help you do that, let them make the appointment for you. Have somebody help you. Reach out. You know, if you're somebody that lives in my area, I will help you. There's little I can do for somebody that lives, you know, far away from me. I could do some research. I guess I could call. I would be willing to do what I could. But, you know, like for my nephew who has bad dental anxiety, he's 35 years old, and anytime he needs a dental appointment, I call and make the appointment for him. And I meet him over there, help him fill paperwork out or whatever needs to be done because it bothers him that much. So get you some support. You know, reach out to someone. I've said this in so many other videos, but it makes all the difference in the world. Pray. I don't want to bring, my spirituality is big to me, so I guess I will talk about it. I pray every morning. You know, if there's something that I'm really anxious about, I pray about it, and it helps. Having a higher power or someone you believe in, your spirituality, that can help with your anxiety a lot, guys. It really can. You know, or talking to a therapist, having someone that you can talk to about what you're going through, you know, that type stuff really, really, really does help. And I apologize. You guys can see the sweat. It's really hot in Kentucky today. It is. And I've been kind of running around trying to do stuff to the house since I didn't work today. But I hope everyone has a fantastic long weekend. I know I'm going to. I'm going to rest. I'm going to try to fire the grill up. If there's anything, I know I've asked if there's anything that you guys have questions about, please leave them in the comments. If there's something that I haven't talked about that you would like me to talk about, let me know. I know someone asked me about making a video on foods or meals they can prepare that are toddler friendly, but also something that they can eat. as far as with dentures. And I've not forgot about you. I just, we prepare some meals here to eat together, but most of the time, and I guess for the last year and a half, I've been preparing food separately just because my diet has changed so much between soft foods and then gradually increasing to what I can eat. But I'll get something made for you. I will. It might take me a little while, but I will help. So please subscribe, guys. Please subscribe. Doing a giveaway, 2 giveaways. One at 500 subscribers and one at 1,000, and I'm giving away a gift card, $100 gift card. Either a Visa gift card or whatever, whoever wins, whatever their choice. So please subscribe. And you guys have a great day, great weekend. I will see you on the flip side.